I'm Dr. Tessa Lim. I'm a board-certified dermatologist practicing here in the province of La Union, and this is my video on vitiligo. So, what is vitiligo? Vitiligo is a pigmentary disorder where functioning melanocytes undergo selective destruction that leads to depigmentation of skin, hair, and mucosal surfaces. So what happens is it's an autoimmune condition, and it targets the melanocytes, the cells that gives our skin its color. And it not only affects the skin, it affects the hair. That's why the hair is color white. And then it can also affect your oral mucosa. So in 50% of cases, it usually starts before the age of 20 years old, and it affects both male and females equally. Next is what are the skin lesions of vitiligo? It usually looks like milk white lesions, which are macules and patches, so they're flat, and then they are surrounded by the normal skin. The normal skin is of course normal in color, so you really see it's paper white, tapos the skin surrounding it is normal. That's why it's obvious. The shapes could be round, oval, or irregular. And then, like I said, the skin not only it does affect the skin, it also affects the hair. So there's leukotrichia, or the hair becomes color white. So there are two types of vitiligo. It could be classified as non-segmental or segmental. For the non-segmental type, it's usually depigmented macules and patches which involve both sides of the body in a symmetrical distribution. So under this type of vitiligo, it could be classified as generalized, acrofacial, wherein it involves the face, the head, the hands, and the feet, and then next is universal, wherein it affects 80% of the body surface area, and then the fourth one is mucosal. For the segmental type, it usually affects one or two more lesions, wherein it's distributed in unilateral segments. So it's not symmetrical, it's not both sides, just one side of the body. So next, what are the treatment options for vitiligo? So for the goals for treating vitiligo, we usually want to minimize the disease progression. The next one is to attain repigmentation, meaning we want the color of the skin to go back to its normal color. And the third one is to achieve cosmetically pleasing results. So what are your topical options for this condition? Number one is topical corticosteroids. The next one is topical calcineurin inhibitors. Examples of this medication is tacrolimus and pimecrolimus. Usually, for this type of treatment, the tacro and pimecrolimus, the onset is earlier. That means na mas mabilis siya makita mo yung effect. But the repigmentation is inferior. So, mas maganda pa rin yung results when you apply the corticosteroids compared to the tacro-pimecrolimus. And then what we usually recommend is with the tacrolimus or pimecrolimus, the results are better if we add phototherapy of NBUVB. And then for this type of medication, we usually recommend it for patients na not younger. So hindi pwede pag younger than 2 years old. It's usually recommended for those who are 2 years old to 15 years old in a 0.03% concentration. Next is the topical vitamin D3 analogs. Example of this is calcipotriene, and then the results for this is better if you combine it with betamethasone, a steroid. And then the next one is phototherapy. For phototherapy, what we usually recommend is NBUVB, which stands for the narrowband ultraviolet B therapy. This is usually done 2 to 3 times a week. And then for PUVA, which is Soralen plus ultraviolet A, it's also done 2 to 3 times a week until the patient improves. The vitiligo improves markedly. So I hope this video has been informative and helpful, and I hope to see you in my next video. Please like the video, subscribe to my channel, just comment if you have any suggestions for the next videos or any questions, and I'd love to hear from you. Thank you and bye.